Hi friends, in today's video we're going to talk about hypothyroidism, and if you like this video make sure to give it a thumbs up and subscribe to my channel. I come out with new content every week for nurses, nursing students, and pre-nursing students. Also make sure to check out all the free resources I have down below as well as an NCLEX and pharmacology study guide, but let's get into it. So hypothyroidism is suboptimal levels of thyroid hormone, and it can occur in patients with previous hyperthyroidism that have been treated with radioiodine or antithyroid medications or a thyroidectomy. So there's different classifications of hypothyroidism. The first is central hypothyroidism. This is failure of the pituitary gland, the hypothalamus, or both to stimulate the production of thyroid hormones. There's also secondary or pituitary hypothyroidism, and this is caused entirely by the pituitary disorder. There's also tertiary or hypothalamic hypothyroidism, and this refers to the cause as a disorder of the hypothalamus, resulting in inadequate secretions of TSH due to decreased stimulation of TRH. So the different causes of hypothyroidism include inflammation of the thyroid gland, which damages the gland cells. There's also autoimmune disease. So the most common forms that cause hypothyroidism is autoimmune thyroiditis or Hashimoto's disease. We can have atrophy of the thyroid gland, which the thyroid gland shrinks in size as a result of aging. We can have therapy for hyperthyroidism, so that again is that radioactive iodine or a thyroidectomy, which can lead to hypothyroidism. Medications such as lithium, iodine compounds, and antithyroid medications can decrease the production of TSH. We can have iodine deficiency or excess, and the imbalance in iodine levels in the body affects the thyroid gland. We can have autoimmune or Hashimoto's thyroiditis, in which the immune system attacks the thyroid gland. And some women can develop hypothyroidism after pregnancy, and this is often called postpartum thyroiditis. So clinical manifestations we're going to see in these patients are extreme fatigue, making it difficult for a person to complete a full day's work or participate in usual activities. They can have menstrual disturbances, so menorrhagia, which is heavy menstrual bleeding, or amenorrhea. We can see increases in weight. They usually begin to gain weight even without an increase in food intake. They'll have cold intolerance even when they're in a warm environment, and their skin can become thickened because of the accumulations of mucopolysaccharides in the subcutaneous tissue. All right, so let's look at the pathophysiology, and you guys, if you've seen my videos before, know that I love these charts. This is just a nice one-page summary of different things to know about hypothyroidism. So anything in the blue is going to be the pathophysiology, the purple is going to be the mechanism, the green is going to be a sign, symptom, or lab finding, and red is going to be a complication. We can see that when it comes to the pathophysiology, you have whatever the cause is, so it could be pituitary gland dysfunction, Hashimoto's thyroiditis, different drugs, diseases, deficiencies, and a pituitary gland dysfunction is going to lead to decreases in the TSH secretions, which is going to lead to a decrease in secretions of T4 and T3 from the thyroid gland. So you're going to see a decrease or inappropriate normal TSH in the context of a low T4, T3. And you're going to see a decrease in inotropic effects on the heart, decreased contractility and rate of contraction of cardiac myocytes. So you're going to see a decreased heart because of the decreased secretion of T3 and T4. The pituitary gland, if it is functioning normally, then the decreased T4 and T3 stimulates TSH release from the pituitary gland. So we'll see an increase in TSH. We'll also see, because of decreases in T3 and T4, we're going to have an increase in peripheral vascular resistance, a loss of vasodilation, decreased metabolic rate, increase of glucoamylglycan deposits in tissues, a decreased expression of LDL receptors, and a decrease in lipoprotein lipase activity. So this is going to lead to increase in diastolic blood pressures. So we may see a narrowed pulse pressure due to loss of vasodilation. We need to watch out for myxedema coma, which we'll see an altered mental state, or hypothermia, a decreased metabolic rate. We're going to see weight gain, fatigue, cold intolerance. We're going to see dry skin, decreased perspirations, constipation, the thickened skin. They may have a hoarse speech, and they may have hyperlipidemia. All right, so different prevention we can take for this is to increase iodine intake. This is really the foremost prevention strategy, and also using early detection. We can have patients undergo thyroid tests after thyroid surgery, or therapy could result in early detection and prompt treatment of hypothyroidism. So a very important complication we need to be aware of is the myxedema coma, and this is this is what makes hypothyroidism life-threatening. It is a decompensated state of severe hypothyroidism in which the patient is hypothermic and unconscious. Myxedema coma is defined as a severe hypothyroidism leading to decreased mental status, hypothermia, and other symptoms related to slowing of functioning in multiple organ systems. It is a medical emergency with a high mortality rate. So you just think hypothyroidism, everything is low, everything is slowing down. So our assessment and diagnostic findings are going to include a physical exam. The thyroid gland can be inspected and palpated routinely in patients. Usually doctors will do this for your yearly physical exam. We can also check serum thyroid stimulating tests, so measuring of serum TSH concentrations, which is the single best screening test of thyroid function because it's highly sensitive. We can also look at serum T3 and T4, which includes protein-bound and free hormone levels that occur in response to TSH secretion. We can also look at thyroid antibodies, so results of testing by immunoassay techniques for antithyroid antibodies can lead to a positive diagnosis of Hashimoto's thyroiditis. So medical management, pharmacological therapy will use synthetic levothyroxine. It's the preferred preparation for treating hypothyroidism and suppressing non-toxic goiters. We want to prevent cardiac dysfunction. So as long as the metabolism is suboptimal and the tissues require relatively little oxygen, a reduction in blood supply is tolerated without overt symptoms of coronary artery disease. And we also want to give supportive therapy. So we should be monitoring oxygen levels. Fluids should be administered cautiously. Applications of external heat should be avoided, and oral thyroid hormone therapy should be continued. So our nursing assessment should include assessment of the thyroid from an anterior and posterior positioning, auscultations of the lobes of the thyroid gland using the diaphragm of the stethoscope to see if there are abnormalities palpated. Assess thyroid gland for firmness, which you'll see in Hashimoto's, or tenderness, which you'll see in thyroid. Our nursing diagnoses can include things like activity intolerance related to fatigue and depressed cognitive processes, risk for imbalanced body temperature related to cold intolerance, constipation related to depressed gastrointestinal function, ineffective breathing pattern related to depressed ventilation, and disturbed thought processes related to depressed metabolism and altered cardiovascular and respiratory status. So our planning and goals for these patients, we can have increase in participation in activities, increase in independence, maintenance of normal body temperatures, return of normal bowel functions, improve respiratory status, maintenance of normal breathing patterns, and improve thought processes. Our nursing interventions can include promote rest, so we'll space activities to promote rest and exercise as tolerated. We want to protect against coldness, so adding an extra layer of clothing or a blanket. We want to avoid external heat exposure, discouraging and avoiding the use of external heat sources. Mind the temperature. We want to monitor the patient's body temperature. We want to increase fluid intake within the limits of a fluid restriction. We want to provide foods high in fiber. We want to manage respiratory symptoms, monitoring respiratory depth, rate, patterns, pulse ox, and ABGs. We want to have pulmonary exercises, so encouraging deep breathing, coughing, and the use of an incentive spirometer. And we want to orient to the present surroundings, so orienting the patient to time, place, dates, and events around them. So our evaluation is going to depend on our patient outcomes, but some examples include increased participation in activities, increased independence, maintained normal body temperature, return of normal bowel function, improved respiratory status, maintained normal breathing pattern, improved thought processes. So our discharge and home care guidelines should include medication compliance, and we need to teach the patient that medications will be taken lifelong. Also cold intolerance, so we need to remind them to avoid extreme cold temperatures until their condition is stable. Want to make sure there's a follow-up visit, and we want to discuss strategies for weight reduction and prevention of constipation, such as high fiber, low calorie intake, and adequate fluid intake. And our documentation should include level of activity, vital signs before, during, and after activity, taking temperature, results of laboratory and diagnostic studies, their bowel patterns, duration of the problem, and any contributing factors, characteristics of their stool, respiratory patterns, breath sounds, and use of accessory muscles, plan of care, teaching plan, responses to interventions, teaching, and actions performed, attainment of progress towards desired outcomes, modifications to the plan of care, and long-term needs. So I hope you guys found this video helpful. If you did, make sure to give it a thumbs up and subscribe down below, and also check out all the free resources I have available down below. I'll see you next time. Bye.